Local healthcare leaders are telling News 8 that a funding dispute with the state could make it harder for ambulance crews to provide the current level of care the next time you need them. Adam Chodak reports.
Every time an ambulance rolls out to care for a patient, built into their response is the work of the Monroe-Livingston Regional EMS Council. They're there to offer guidance, coordination, and oversight of EMS outfits across our area. A lot of that is done through what's called a program agency, and the University of Rochester has partnered with the council to provide a lot of the agency's services. For about 3 decades, the state has reimbursed U of R for that work. But because of a contract dispute, that hasn't happened for almost a year, prompting concern among emergency medicine leaders like U of R's Dr. Michael Kamali that funding may never return.
Having that glue or this network go away moves us really a couple steps backwards in the care of patients and the care of our community. So for me, as chair of emergency medicine overseeing our level 1 trauma center, stroke center, cardiac center, I have really significant concerns about that.
Local EMS leader Jonathan Smith stresses it's not just the immediate care that could be impacted, but also programs like AED registration.
So if we lose the ability to understand where these defibrillators are, we lose the ability to provide accurate and timely guidance to folks who call in one of the most critical emergencies that folks in the community will face.
U of R's pre-hospital medicine chair, Dr. Jeremy Cushman, says the state has historically paid about $180,000 a year, a number that hasn't changed in all that time.
So it kind of doesn't make sense. And then there's no communication as to why. Why are we being defunded to do this work?
And Adam adds other programs across the state are having the same issue. In fact, Buffalo's recently closed. We reached out to the Hochul administration but have yet to hear back.